You're watching the station that works for you. Now, ABC2 News at 6.
Now we're talking about breast cancer treatment today. Get your answers question by calling us right now at 410-481-2222. Tonight, we're talking about breast health. MedStar Health Cancer Network is taking your calls right now, and we are joined by Dr. Maen Farha, director of the Breast Center at MedStar Union Memorial Hospital. Thank you so much for joining us.
Oh, you are welcome, Melanie.
Dr. Farha, either by a self-exam or a mammogram, a lump is found. What comes next?
Patient who has new symptoms need a full workup. They need to see a breast specialist. Sometimes their OB/GYN might be comfortable with that. Most often they end up seeing a breast surgeon. We work them up, we send them for the proper imaging. Dr. Townsend Watt talks about screening versus diagnostic imaging. This will be diagnostic imaging. What you try to do is to figure out whether this mass is possibly benign or malignant. For example, some lumps are simple cysts that are clearly benign, that these are treated differently. But whenever there's any suspicion, the next step is to work up the patient all the way, usually ends up with a biopsy.
How can you be sure you're getting all of the tissue that has cancer cells?
So we look at the imaging, we see something suspicious. Most of the biopsies we do are needle biopsies. So these are done under local anesthesia. They're well tolerated, although they're kind of scary and very stressful. But we got enough samples of tissue to make a diagnosis. Now, if the tissue that we get is not concordant with what we see on imaging, then we take more tissue. We do another biopsy or do a different kind of biopsy, do an open biopsy. So we have to be satisfied that what we see on imaging is actually well represented by the samples we took.
You know, aside from concerns about pain, I think the number one might be, will they get it all? How confident can a patient be going into this type of procedure that the cancer will be removed?
Well, the intent of most biopsies nowadays is to get enough samples to make a diagnosis. Now you make a diagnosis of cancer, then the key is planning a good course of treatment for the patient. Most breast cancer patients need surgery first. So it's up to the surgeon and his or her team to design the proper operation for the patient. Planning the surgery is very important. But some patients may need other treatments before surgery. Somebody with a large tumor may need the tumor shrunk before we operate on it. So it's our role, and that's why we have to plan a procedure that will get a negative margins. So for things that you can't feel, the design of the operation is key. We've been recently using a new device that helps us find these tumors and be more exact in finding them. Because things that you can't feel, the radiologist usually puts a needle for you to find them, and that's kind of stressful for the patients. So there are new technologies that are helping this nowadays.
Thank you so much, Dr. Farha. And we'll be taking your calls up until 6:30. Give us a call right now. There's also a local effort to help fight breast cancer. The Susan G. Komen Race for the Cure is this Sunday. It returns to Baltimore at McHenry Row. Organizers expect around 8,000 people and hope to raise $850,000. ABC2 is a proud sponsor. You can find more information about the event and read stories from survivors on our website, abc2news.com/Komen.
All right, Mallory, doctor, thank you. It's that.